Fetal Alcohol Spectrum Disorders is the fancy name for a group of disabilities that are really based on birth defects. When a mom drinks during the pregnancy, the blood alcohol level in her blood goes up, and the blood alcohol level in the baby goes up too. That blood alcohol level, that elevated blood alcohol level, is toxic, and it causes actual destruction of the developing embryo. So you get a whole array of different conditions. Some of them are physical, some of them have to do with developmental and intellectual disability. The most difficult ones of all are the ones that present as behavioral problems. And the parents, the caregivers, often their adoptive parents, are baffled. Why is my child not doing what I tell him? Lots of times, if I help parents to just simplify their language and not make any assumptions about what a child is remembering, we solve a lot of problems right there. In the general population, it's about 1 per 100 kids. Fetal alcohol spectrum is more common in the general population. It's more common than autism, it's more common than Down syndrome, and yet we don't talk about it. The World Health Organization has just come out with a statement calling this a global pandemic. This is a huge problem. People know that a baby right after it's born has to be treated delicately, and yet they don't recognize the damage that can be done by the alcohol that the mother drinks. When we think about what the impact of other substances are, we have really good data that shows the most dangerous of all of them really is the alcohol. In comparison with heroin, comparison with cocaine, comparison with methamphetamines, marijuana. Of all of those substances, we have much more data that show that alcohol is what does the damage. I'm often asked by people, is the brain damage that's done irreversible? And unfortunately, the answer to that is yes, it is. But there's a lot that we can do to encourage increased brain development in those first several years of life that can make a huge difference. The earlier we make the diagnosis, the better. These kids represent a huge number of the kids in our foster care system that get bounced from one house to another because they are thought of as just being difficult and bad kids. If they make it to our clinic, between our diagnostic process and the mental health processes that we have in place here, we can educate the parents and give them techniques for that, then we'll be able to make a huge difference in how they interact and have a much, much better outcome. Our support of the caregiver is the most important therapeutic intervention we can make. Most of our best therapeutic processes for kids with fetal alcohol issues that we have here at VIP at the Community Mental Health Center are classes, first of all, called the Triumph classes, which are oriented toward teaching the parents some of the things that we've been talking about today about how these children function. Another program that we have is called Families Moving Forward, and it's a fairly intensive program about how to manage the child. The best thing we can do for these children is to teach their caregivers, because they're the ones that are doing the actual treatment and therapy and long-term care for these kids.